Hello and welcome to this narrated PowerPoint that's going to go through the knowledge that you're going to need for your next health exam. It's going to feature 3 8-mark questions and be on the following topics. You'll need to know all of these for this exam. So you'll need to know about public health problems in the 19th century, the creation of the NHS, the work of Fleming and the work of Pasteur as well. So the first area that you need to know about is public health problems in the 19th century, so the 1800s. So we're going to start off with just generally thinking about what public health problems were there in the 1800s. Now at this point, Britain was going through the Industrial Revolution, which began in the late 1700s. Now, as part of this, many people moved from the countryside to towns. Towns grew so quickly that the housing was often of poor quality. For instance, they shared privy toilets with up to 30 other families, there were water pumps in the streets, and people lived in single rooms. That's where they eat, sleep, and also cook. So there was some attempt to get rid of household waste. There were nightmen who collected the cesspit, that's the toilet waste, and some household waste, but they often just threw it into rivers or piled it up for the rain to wash away. So effectively, they didn't have a good system at getting rid of waste, and that caused massive problems with lots of vermin, and also caused problems with a dirty water supply. Remember that they're throwing their waste into rivers, but that's also where a lot of people are still collecting their water from. So obviously that's going to cause problems with diseases like cholera. As a result of these poor living conditions, the average life expectancy was 16 for labourers in the East End of London in 1842 and 45 years old if you were rich. So we can see this had a massive impact on life expectancy. And generally 57% of children died before the age of 5. This is because of problems with healthcare, the fact that many people couldn't afford to go and see a doctor, and there were lots of contagious diseases that spread quickly due to these poor living and working conditions. For instance, diseases like typhoid, typhus, TB, cholera, diphtheria, and smallpox, amongst some others as well. The main disease that you need to know about is cholera. This is something that arrived in Britain in 1831 and had a significant impact, obviously negatively with leading to so many deaths, but also had a positive impact to some extent with the fact that it led to some public health improvements. Now, the disease of cholera spreads when infected sewage gets into the drinking water. So when you basically drink something that is contaminated with the feces of somebody who's got cholera. Now, they didn't know this at first, and that's one of the reasons why cholera has such a significant impact and kills over 100,000 people across a few outbreaks, because they didn't know what caused it, they didn't know about the importance of clean drinking water, and instead they believed in miasma, that basically it was spread through bad smells. Now, this is something that first came to Britain in 1831, and it was brought through trade routes from India. So it's very much like other public health problems they'd had before, like for instance the Black Death being brought from China back in the 1300s. Here it's brought from India through trade, and obviously once it gets to Britain it spreads quite quickly. In the first outbreak that started in 1831, 50,000 people died. But there were further outbreaks that happened as well. For instance, there was another one in 1848 where another 60,000 people died, and then another one in 1853 where another 20,000 people died. And it's during that 1853 outbreak that John Snow is doing his work in Soho in London. So as we mentioned, obviously this was tragic for all those people that lost their lives and really terrified the London population in particular. But cholera did actually lead to some improvements in public health. So in terms of its long-term significance, it did actually cause some positive changes. Before the outbreaks of cholera, before 1831, we could describe the government's policy as laissez-faire. They believed in self-help and that actually it wasn't their job to get involved and improve the public health conditions. However, the fact that so many people were dying of these terrifying outbreaks of cholera led to people calling for greater government intervention. For instance, in 1842, a man called Chadwick wrote a report that called for better living conditions. He Didn't get everything right. For instance, he talked about waste being collected and thrown into the River Thames, but at least he was talking about trying to do something to improve conditions for ordinary people. As a result of the first outbreak of cholera and the Chadwick Report, that was some of the crucial factors that led to the first ever Public Health Act in 1848. Now, that was a monumental change and a move in the right direction. However, remember that it wasn't that significant overall because of its lack of impact. It wasn't compulsory. The government were not fully committed to this idea of cleaning up the streets, and they weren't fully committed to this idea of public health measures. And therefore, there were some improvements in some towns, for instance, Leeds, and generally there was £11 million spent on these improvements. However, overall, not all towns actually did improve because they weren't forced to. It wasn't compulsory. So what you need to know from this side is that cholera had a significant impact on public health and did lead to some improvements over time. This is the final area that you need to know about for public health problems in the 19th century. You need to know about the work of John Snow and what he did with cholera, and also the Great Stink. These two things are really important because they led to the 1875 Second Public Health Act that really successfully built on the initial improvements from the 1848 First Public Health Act. So we've already talked about the situation before, that lots of people had been dying of cholera since it came to Britain in 1831. Now, we've already mentioned this, but in 1854, 20,000 more people had died of cholera. Now, John Snow decided to investigate, and he managed to prove the link between the contaminated water and cholera. This began when he was investigating the area around the Broad Street pump in Soho. He found, by mapping all of the deaths on a map, that all victims got their water from the same water pump. He then decided to go and remove the handle from that water pump so that people were forced to use another, and he found that no more people died. Essentially, it turns out from his investigation that there was a toilet that was leaking into that water supply, and therefore that is why so many people in that specific area were dying of cholera. Now, the reason why that experiment is so important is because he'd proven that it wasn't actually caused by miasma, but instead by contagion, by coming into direct contact with a cholera sufferer, in this case drinking the water contaminated by the victim's diarrhea. The government didn't do very much about this because this discovery was made in 1854, and it's not until 1875 that they introduced things like proper sewers and clean drinking water. But this was still a really crucial discovery because it leads to the change that happens afterwards. It is still crucial even though it takes a while for people to listen. So why did the government start to listen then? They knew that there was an impact between dirty water and cholera. However, it wasn't affecting them, the MPs themselves, very much at that point. They weren't necessarily living in these horrible cities. They weren't necessarily living in these terrible living conditions. So they were, however, affected from 1858 when we get the Great Stink. Now, London, as a result of the poor public health conditions, would have been pretty smelly all the time in summer. But in 1858, as a result of a particularly strong heat wave, it was supposed to be absolutely foul in terms of the smell. There was a lot of waste, remember, that was continued to be dumped in the Thames, and plus the summer had created a smell that was so bad that it actually stopped Parliament from meeting. So now that they are being affected by this because the Thames smells so much because of the human sewage, rubbish, horse dung, slaughterhouse waste and chemicals from the factories, they then decided to do something about it. And you might remember about how Bazalgette was hired to try and build a sewer system for London, and that has become the blueprint of the modern systems that we use today. Now, he received a lot of money to build these sewers, and as a result of this effective system, cholera never returned to London again. This proved to politicians the importance of John Snow's work, but also proved the importance that they acted on it. So as a result of lots of different factors, including Snow's work from 1854, including the Great Stink of 1858, the fact that working class men got the vote in 1867, all of this then led to the government finally deciding to pass the Second Public Health Act in 1875. Now, this was much better than the 1848 one because this actually forced councils to appoint health inspectors, people who had to make sure that these changes were actually being implemented. It also made sure that people had access to clean water, that they had some kind of sewage system, and also that there were proper rubbish collections, where that rubbish wasn't just thrown into the Thames, but disposed of properly. It would be a really good idea to now watch the BBC Teach video on the work of John Snow. This will help make what we've just talked through a little bit more memorable, and you can find the links to this either in the YouTube description if you're watching on YouTube itself, or you can go back onto Show My Homework and you'll find that the link to the video has been put there as well. So watch that 5-minute video before moving on to the next section on the NHS. We've just thought about all of the public health problems in the 1800s in the 19th century. We're now going to think about something that happened in the 20th century when the NHS was created and to what extent that has helped improve public health. Now, we've already seen that the government had begun to end its laissez-faire approach to public health with the 1875 Second Public Health Act. That had introduced those compulsory changes and forced towns to clean up, to make sure they provided clean running water and rubbish collections and sewage disposal as well. However, there were still issues with public health. Despite the fact that the towns had cleaned up, there were still issues with the people generally not being very healthy. So this had been proven with people like Booth and Rowntree's studies in York and London that happened between 1899 and 1901. They'd revealed that up to half the people in these areas were living in terrible conditions of poverty. There was also the Boer War, which is between 1899 and 1902, where the government found that 40% of their recruits were unfit to fight. Now, this kind of shock and the idea that Britain wouldn't be able to have a healthy enough army did lead to the Liberal government putting in place some liberal reforms between 1906 and 1914. This is where they were trying to do things to improve the health of the nation and introduce things like the Pensions Act and also free school meals for children in 1906. However, despite the fact that Liberal reforms were the start of them trying to improve conditions for ordinary people, there were still issues that remained that the government in the 1940s, the Labour government, tried to do something about. We can also see that there were still massive issues by the fact that in 1942, 100 years after Chadwick's report, Beveridge writes a report where he talks about the problems that society is still facing. And he talks about the 5 giants, the big issues that they need to deal with: want, disease, ignorance, squalor, and idleness. Now, as a result of the Beveridge report, the government started to actually take responsibility for caring for its citizens, as he asked for, from the cradle to the grave. They introduced what we now term as the welfare state, for instance, doing things like creating the NHS in 1948, doing things like the Town and Country Planning Act in 1947 that got rid of slum housing, and also introducing the 1945 Family Allowances Act that gave a small payment for children. So before the NHS was created, essentially there had been some attempts to try and look after the health of the nation with things like the Liberal reforms, but these problems hadn't been solved, and we can see that with the fact that Beveridge wrote about the 5 giants. You also need to know about the creation of the NHS and its significance. Now, before 1948, there were about 8 million people in England who had never seen a doctor because they couldn't afford to. Remember that before the NHS, all of the physicians would have been private, and therefore it was outside of most ordinary people's reach. Now, Bevan had read the Beveridge Report of 1942 and had heard about the recommendation to create a National Health Service. And he, being the Health Minister, decided to create one in 1948. So Bevan is creating the NHS on the recommendation of Beveridge, who wrote the report. The idea that Bevan wanted to create was a system that everybody paid into if they were working, and everyone had access to, whether they paid into it or not. Now, this was a radical change and really represents a big shift away from that laissez-faire idea. Remember, it's not even until 1848, that's 100 years before, that we even get any kind of Public Health Act, and we know that there were lots of weaknesses within that. So it really shows the importance of this kind of change in attitudes, that within 100 years we go from the first ever Public Health Act to something like the NHS. So let's think about the significance of it, and you'll need to know about both the short-term and long-term significance. So first of all, in terms of the short-term significance, it demonstrates government intervention in public health and a massive change of attitude that I just talked about before. Also, we can see that actually this was something that faced real opposition that the government pursued anyway. For instance, at first, lots of doctors didn't like the idea of the NHS. They wanted to keep their independence, they wanted to keep their private practice, and to be able to charge whatever they wanted for treatment and diagnosis. The NHS took this away for many. Only 10% of doctors actually supported it in 1948, and there was also lots of opposition from Conservative politicians. For instance, Winston Churchill described it as a scourge on the country and talked about it being like Nazi Germany. So there have been lots of criticism from lots of people when the NHS was first created. Bevan tried to deal with it and tried to make doctors more supportive of it by allowing them to also continue to treat some private patients. So basically he compromised with them to try and please people. Now the doctors didn't like it, the Conservatives didn't like it, but there was a lot of support from this from ordinary working people in Britain, and there was a massive demand for the NHS services. As a result of this really high demand, because of its popularity, the NHS actually had to bring in prescription charges quite early on. They also had to bring in charges for spectacles and also some fees for dental treatment by 1952. So within a few years, the demand had greatly exceeded the expectations. If we think about the long-term significance and how this has affected Britain since 1948, it has had a massive positive impact. For instance, it's meant that maternity services and services for children have led to a massive reduction in infant and child deaths. Remember, in the 1800s, 57% of children died before the age of 5. Fortunately, as a result of things like the NHS, we don't have those issues anymore. There's also been so many new hospitals that have been built to serve communities with the latest treatments and facilities available. The NHS have also led a campaign of vaccinations that have eradicated disease such as polio and tuberculosis from Britain. It's had a massive impact and saved so many people's lives. However, despite the positives, it has actually cost a lot more than originally estimated. Remember, we talked about earlier that the short-term significance, even by 1952, they're having to introduce fees. Well, the NHS is something that has an enormous cost today, even greater than it did in the 1950s. For instance, in 2016, the NHS cost £116 billion to run. And obviously, there are lots of times when the NHS can't quite cope with the demand. As a result of the fact there's a lot of demand and there's not enough money, the NHS can't always provide the most up-to-date and effective drugs, and they have to make very difficult decisions about which drugs they're going to buy for which patients. So there's lots of difficult choices, and there's some people that believe that the NHS now doesn't do enough. However, despite the fact that there is criticisms about waiting times for the NHS, it has had a massive impact on the English population, and it has massively improved life expectancy. For instance, if we think about when it was created in 1948, the average life expectancy was 66 for women, but it's now increased to 83. And when it was created, the average life expectancy for men was 64, but it's now 79. So it's had an enormous impact, not only extending people's life expectancy, but also giving them a better quality of life as well. So the NHS is something that is now largely popular. It's not without its problems, but it has had an enormous impact on public health in Britain. The next area that you need to know about is the work of Louis Pasteur. Now, you're going to have to know what the significance of his work is. And in order to think about how significant it was, we have to think about how had ideas about medicine changed. What was the situation like before, and what did he do to change that situation? Well, before, in terms of their understanding of what caused disease, they had a very limited understanding. They still believed in the medieval theory of miasma, this idea of bad smells basically cause disease, and they also believed in the theory of spontaneous generation, that disease basically came out of nowhere. They didn't believe in germs, and obviously Louis Pasteur is very famous for coming up with germ theory. So if you have to talk about his short-term significance, you need to talk about what he did. So first of all, he was asked by an alcohol company to investigate why their alcohol turned sour. He did an experiment where he heated liquids and then he used straight and curved flasks to try and prove that sometimes there was bacteria in the air that could then infect a certain liquid. So the ones that he did where he heated the flask and then left a curved tube, the alcohol itself was fine and didn't go off, and the ones where he heated the liquid and then left them in a straight flask, they were then flasks that grew lots of bacteria in them as a result of the bacteria in the air. So he wrote a book about it after he'd done his famous experiment, and this is where he coined the term germ theory in 1861. Now, a lot of people made fun of Louis Pasteur for his discovery at first. It wasn't widely accepted until we get things like the 1866 cattle plague, where people all of a sudden do start to believe there could be a bacteria that could cause something as large as a cow to become ill. Before, people hadn't thought that something as small as a germ that you can't see could make a human ill, and this started to change people's minds. There's also the work of Robert Koch that you have to know about, because he was really important in getting people to listen to Louis Pasteur, despite the fact that there was a lot of rivalry between them. Now, Robert Koch is known as the father of modern bacteriology because he discovered specific microbes. Louis Pasteur thought that all microbes, all germs were the same, but Koch actually discovered that there were specific microbes that cause specific diseases. For instance, he found and isolated the bacteria that caused the disease of anthrax, and then he proved it was that particular bacteria that caused it by injecting it into 8 healthy mice. So he'd done lots of things like that to prove his experiments. His work helped people to believe that germs could cause disease in humans. He also did lots of important experiments where he isolated the bacteria that causes TB in 1882 and the bacteria that causes cholera in 1883. Now, obviously, Louis Pasteur being French and Robert Koch being German, at this time when the Franco-Prussian War was going on, created this really intense rivalry between them. And Louis Pasteur was upset that his work had basically been upstaged by this German Robert Koch. So he decided to try and work on finding vaccines. So where he discovered germs, and Koch had then built on it by finding specific germs that cause specific diseases, Louis Pasteur then wanted to find some solutions, some vaccines to stop people getting ill from those particular diseases. And he was working with a team of scientists. One of them was called Charles Chamberlain. Now, essentially what they did is they managed to find a solution to chicken cholera. They found that if they injected chickens with old bacteria that had been left, it had basically weakened the disease, and when they then injected the chickens with it, they found that they survived. So they'd accidentally, by chance, created this or found this discovery that a weakened version of a disease protected them from a new, stronger bacteria of the same disease. Now, there had already been a vaccine that had been discovered before with Edward Jenner's smallpox vaccination from 1798. But he never understood why it worked, why giving people cowpox protected them from smallpox. Here, though, Louis Pasteur has discovered how vaccines work, and it means that they can then create many more vaccines for many other diseases. They ended up creating vaccines for anthrax and rabies, and obviously now in modern day we use lots of different vaccines to help prevent lots of different diseases. This was absolutely crucial because he's the first person to create vaccines in a lab, and it means that they can now create vaccines on a mass scale. Now, Pasteur's work is not only significant for those vaccines, but also the fact that he led to the development of aseptic surgery, about creating surgery in a germ-free environment. For instance, Lister read his work and read the germ theory of 1861. and ended up using carbolic acid. And when that was successful and reduced the death rate because it lowered the chance of infections, they then started to pursue more of an aseptic surgery, for instance, using things like gloves and sterilizing the equipment. So Louis Pasteur was an incredibly significant individual. We think about that situation before with people believing in spontaneous generation and miasma. He's disproving those theories and actually coming up with much more scientific explanations for disease. Obviously, Robert Koch and Lister take his work further, but still he was an incredibly significant individual that inspired those other scientists. Now, it'd be a really good idea to watch the video about Louis Pasteur and the work of Robert Koch as well. This is on Show My Homework, and also there is a link in the YouTube description box as well if you want to watch it. It's only 5 minutes long, but I would strongly recommend that you do. The next individual that you need to know about is Fleming and the significance of his work on penicillin. Now, obviously, in order to think about how significant someone is, we need to think about what was the situation like before and how did they change things. Thanks to Louis Pasteur, who published germ theory in 1861, they did know about germs. Remember that people like Robert Koch had also been part of this revolution in science, trying to find out about what bacteria cause different diseases, and they've made great progress with it. Now, there was one particular bacteria that they were really struggling with, and that bacteria was called Staphylococci. This bacteria had caused lots of deaths of soldiers in the First World War, and that is what inspired Fleming to try and find a cure, a solution to this bacteria. And he does a lot of his work in 1928. Now, as we've already mentioned, Fleming wanted to try and find a better way of treating infected wounds and started experimenting. Now, the story goes that he put some of this Staphylococci bacteria in a petri dish and then left it for a while by chance. He's supposed to have gone away on holiday, and when he comes back, he finds that there has been a mould growing in the dish with the Staphylococci bacteria. And this mould has basically prevented this bacteria from spreading. There's none of this bacteria that's growing next to the mould, which makes him realise that it can basically cure it and prevent this bacteria from hurting people. So he decided to take a sample of the mould and made a juice from it, and he called this penicillin. Now, obviously, at the time, he didn't know the significance of this discovery. He had basically discovered the first antibiotic, as we mentioned, something that has already saved the lives of about 200 million people. Now, he did that experiment in 1928 and published his results in 1929. But this is where Fleming's discovery kind of ends, because he doesn't raise enough funds to develop the drug, and mass producing quantities of this drug would be really, really difficult. He also doesn't go as far as doing things like animal testing, so he doesn't quite realise the significance of his discovery. He does write a paper on it, and that paper is incredibly important, but that is where kind of Fleming's story ends. Now, Florian Chain end up reading his paper that he published in 1929, and they read through this work and they realise the significance of it and the importance of penicillin in its ability to be able to kill this really powerful bacteria. Now, they go further than Fleming and they actually test it on 8 mice. And when that goes well and these mice don't die from this Staphylococci bacteria, they then decide to do a human trial. And they do a trial on a police officer who is dying from an infection. Now, while they're able to keep giving him penicillin, this police officer continues to live. And when they run out of penicillin, unfortunately, he dies. Now, this is really important and significant because they've proven that penicillin can help fight infection and keep people alive. Now, at first, they found it very difficult to get funding for this discovery, but during the Second World War, they received $80 million from the US government to mass produce penicillin, because again, in the Second World War, lots of soldiers were dying from infection. So war is a crucial factor here that led to the development of penicillin. Just like, I suppose, war was really crucial when it came to things like the development of germ theory, because it was that Franco-German rivalry that really pushed forward Louis Pasteur's work. So here again, we've got war as a factor. Now, as a result of them mass producing penicillin, we've got it's estimated to have saved the lives between 12 and 15% of wounded Allied soldiers. Now, once that had been so successful and they'd proven it saved all these lives of all these soldiers, afterwards we start to get the mass production of penicillin, which then is not only used to treat soldiers, but loads of different infections that were problems at this point in the 1940s. For instance, they start using penicillin to treat things like scarlet fever and then STDs as well, like syphilis and gonorrhea. Now, since that point, as we've said already, it's estimated to save the lives of 200 million people. We've all probably been prescribed penicillin at some point in our lives. And as a result of the significance of this discovery, all three people, Fleming, Florey, and Chain, all received the Nobel Prize for Medicine. So here we can see Fleming comes up with the initial discovery and writes about penicillin. But it's then other people that take that work further. Florey and Chain build on his work, just like Robert Koch and Lister did with Pasteur's germ theory. Now, it'd be a really wise idea to watch this 5-minute video that's all about Fleming, Florey and Chain. You can find the links to this on Show My Homework, or you can look in the YouTube video description and you'll find a link there. So finally, the last area on your sheet that you need to know about is the similarities between Fleming and also Pasteur. There's lots of different similarities between them, but here's an example of some similarities that you could pick out. First of all, both published their work and then their work was developed further by other people. So their original work was incredibly significant. You know, Pasteur's work on germ theory in 1861, his work on vaccines, and with Fleming, he published his work on penicillin. But it's other people that developed it further and made it into something that is absolutely pivotal and essential for medicine. For instance, if we think about Louis Pasteur, his work is obviously developed by Koch, who then proves that there's lots of different types of bacteria and actually finds the bacteria that's responsible for causing certain diseases, which then leads to the vaccines that Louis Pasteur comes up with. And if we think about Fleming, well, Florey and Chain are the ones that actually test it on animals, test it on people, and lead to it being mass produced. But obviously, none of that work would be possible without Fleming and Pasteur. Next, we can think about their similar methods and the importance of science and observation and scientific methods as well. So if we think about Louis Pasteur, obviously his whole germ theory started with him performing the flask experiment, and he also performed lots of experiments when it came to chicken cholera. He tried lots of different things to try and weaken that disease and allow the livestock to be able to live despite being injected with particular strains of cholera. Fleming had also done lots of scientific experiments and had been doing things like taking the Staphylococcus germ and putting it into petri dishes and trying to see what could kill that bacteria. Both of them as well were very scientific in their methods, but there was also this element of chance as well, where, for instance, remember Louis Pasteur had gone away on holiday, and Charles Chamberlain, when he came back from holiday as well, injected that chicken with a weakened form of bacteria and obviously found that that worked. So there's an element of chance in that discovery. And it's the same with Fleming as well. He'd also gone on holiday and he'd left some of the Staphylococcus bacteria in a petri dish, and when he came back he found penicillin was growing next to it. So there's an element of chance in both their discoveries and also scientific methods. And the final similarity that we've got here is that they both also had a significant impact on medicine and saved numerous lives. Now, if we think about Louis Pasteur, without germ theory, we wouldn't have vaccinations and we wouldn't have aseptic surgery, and therefore a lot more people would have died of infections and lots of different diseases. We might have had to worry about diseases like TB and things like that wouldn't have been eradicated in England. Things like smallpox might not have been eradicated worldwide if vaccines hadn't gained such a following after Louis Pasteur's work. If we think about Fleming and his impact with penicillin, obviously it's estimated to have saved 200 million lives. And we can see the real importance of his discovery through the concerns that we've got about superbugs now and the fact that antibiotics are becoming less effective. So we can see that both of these individuals created discoveries that have had a massive impact on lots of different communities, increasing life expectancy, and obviously saving lots of people's lives. So there we've got some similarities. Obviously, make sure you know those and the significance of each individual, because you don't know what the question's going to be. Remember, the compare question could ask you to compare these two, or it could ask you to compare public health in the 1800s with the creation of the NHS in 1948. So make sure you're prepared for both of those, and make sure you're generally revising these topics. So remember, these are the topics that we've gone through on this video. Make sure you know about public health in the 1800s, the NHS, Fleming and Pasteur.